Okay, let's see if this will take. So yeah, generally feeling pretty good.
Good.
And I'm eating pretty well, and sleeping pretty well. Better. That's improving.
Good. I'm glad to hear that.
Yeah.
So really kind of the cloudiness is the main concern right now.
Yeah, sure. I mean,
Yeah. I wish there was an easy solution for that. Unfortunately, there is not.
yeah.
Oh, please, before you actually record,
sure.
there's other patient information
Oh,
on here,
okay.
so
Okay.
hold on, let me get rid of that before you get pictures in there. Sorry, I didn't realize I thought you meant audio record, not.
No, that's okay.
Just getting up the two sets of images side by side.
Thanks.
Yummy.
So on this side is going to be the one from October 26th. On that side, the recent one on December 12th. And what you see is this asymmetry. That's your left side, that's your right side. So on here, you see, sorry, just want to make sure so you see this large mass over here. You can see there's that asymmetry.
Yeah.
That those are what your sinuses are supposed to look like there in the inside of your nose.
Yeah.
But in here, there's this mass, and over here, it's much less. You can see that's much more symmetric on the side. There's still a little bit of kind of stuff here that shouldn't be, kind of right there as compared to that, but quite a bit smaller than before.
Yeah.
So I think overall we've seen a pretty dramatic improvement, and I printed out the report for you to take home, and that's what the report says too. It says markedly decreased size of the large nasopharyngeal mass with only small residual mass.
Yeah.
So that's exactly what we were hoping to see with the chemotherapy.
Okay.
So I'm happy about that.
Yeah.
Yeah, and Dr. Sangvi has taken a look at these scans. He's happy about it as well.
Okay.
So I can pull up the liver scans as well. It's a bit comparing apples to oranges because the scan that you had before was a PET CT, and this time you had a regular CT.
Uh-huh.
So they give you very similar information, but they will look a little bit different when I show you.
Okay. Is there anything you're not happy about?
Nope.
Okay.
Oh, come on. Except how the system sometimes makes it a little challenging to pull things up, but it's not your fault.
UX. It matters so much.
It's yeah. So I'll show you on the PET CT what we were concerned about. So this is the PET CT done October 25th. Now, we had the part in the nasopharynx. That's better seen on the MRI. The MRI just is a better study for looking at that area. You have the lymph nodes, which have obviously improved as well. But what we're comparing on the CT scan is basically that spot.
Yeah.
So that spot, when they measured it, I believe they measured it around 4.5 centimeters back then, and it's quite a bit smaller now.
Oh, really?
So yeah, there's the size compared to that. And like I said, it's kind
It's
of
1.91 centimeters?
Yeah, let me see exactly what they called it. Yeah, 1.9, and there were a few kind of satellite spots before that also look better. So this is the one that was biopsied, and that's the one that looks quite a bit better. This looks like a benign cyst, and that's pretty common. If we scan probably about 100 people, we would probably find benign cysts in the liver, about 30 of them or so, and that doesn't seem to really matter for your long-term health. So what matters is that one, and it's clearly getting quite a bit better.
Awesome.
Yeah, so like I said, I'm happy. Let me see if I can, this might give you a little bit of a better sense of comparison of the liver, although it's kind of hard on it's harder to see on this one, but regardless, it's clearly gotten smaller compared to before. So, so you've met with Dr. Sangvi. I know you guys have talked about proton radiation
Right.
and looking to start next week. Is that correct?
Well, what I thought that today's meeting was about was to decide, like, are we doing another round of chemo or are we going to radiation?
The plan was to go to radiation.
Okay.
Yeah. So with chemotherapy, but with a lower dose chemo, which is why Linda's here. I think you've met Linda before, right?
Yeah,
yes.
yeah.
Sorry, I should have started
So
off
it's
with that, but I know you were anxious to hear the results. But yeah, the plan is to do now a low dose chemotherapy. So you've been getting 2 drugs, the cisplatin and docetaxel. Plan is to stop the docetaxel now, or Taxotere, and keep the cisplatin going, but a weekly lower dose.
Oh,
Weekly.
Yeah.
I see.
And
Yeah.
how would that be 3 weeks or?
It would be with the radiation therapy, so that's
7 weeks.
7 weeks.
Got
yeah.
it. Okay.
Yeah, and the idea behind the low dose is basically to make the radiation work better.
Got it.
So this chemotherapy by itself probably wouldn't do a whole lot for your tumor, but we know that it makes the tumor cells more sensitive to radiation and gives radiation a better chance of getting rid of this.
Okay.
And would there be? Do you think it's possible to have a benefit on the liver?
Yeah, the liver will keep a close eye on during treatment because eventually you're going to need more for the liver as well. The idea is this is kind of the most threatening area. We treat that first, but probably later on we're going to be looking at doing some radiation to the liver in addition because I don't think
Got it.
chemotherapy by itself can make this entirely go away. It's made it smaller. It's
Yeah.
clearly working somewhat,
Yeah.
but Dr. Sangvi and I were talking about probably adding radiation onto the liver, and that wouldn't be the 7 weeks of radiation. That would be a shorter course of
And that would
radiation.
be after that.
Yeah.
Okay. And after more scans. So.
Yeah.
Will he get scanned during the course of those 7 weeks?
So up here, Dr. Sangvi will probably do kind of on treatment scans, which are kind of quick and dirty scans just to make sure everything's lining up. As far as the final results in this area, we're not going to be able to see that until about 6 to 7 weeks after the end of radiation therapy. Or sorry, actually about 12 weeks after the end of radiation therapy is when you see the full effects of radiation. As far as the liver goes, we'll probably take an intermediate look at the liver about 6 or 7 weeks from now.
Got it.
Just to make sure that it hasn't started taking off and doing wacky things while you're on treatment. Because yeah, with the lower dose chemotherapy, I am concerned that it may not have the effects on the liver that the higher dose chemotherapy does. So we're kind of, we're fighting a battle on 2 fronts, so we have to figure out which to prioritize. And right now we're prioritizing up here because we want to keep your brain working.
Yeah, yeah.
And this is frighteningly close to some pretty important structures in the
Yeah.
brain.
Right. And is that more like behind his eye?
Yeah.
Is where you're gesturing? Got it.
Yeah, so it's sort of basically where your nose and your throat come together is where this started, and it sort of grew out from there. It's a hard area, but it's basically like if you drew a line between my 2 fingers,
right.
that's kind of
Got
where
it.
it would start.
Got it. Okay. All right. Well, that's all really great news.
I'm happy about it. I mean, we had a good sense that you were responding because your face started looking normal again, and you were feeling better and in less pain. So this kind of confirms what we were already suspecting, but I'm really happy about it.
Awesome. And is that radiation appointment already set for next week?
Let me check with Dr. Sangvi. You haven't heard from the Proton Center at all about
We
timing?
had, I got a mask made. And,
Oh, good. Okay.
Yeah.
But,
you already
they
started.
just haven't told you the start date
Oh,
yet.
no, because
Okay.
they're in the midst of the mapping,
Okay.
right?
Yeah,
Yeah, I think they're in the midst of their 2-week, it's 2 business week mapping process. too.
which would be next week.
Yeah.
Yeah.
Yeah. So they told me that they were tentatively looking at next week. I'm not sure what day next
Okay.
week. Around the holidays, things always get a
Yeah,
little bit
of
thrown
course.
off.
Yeah.
So whenever they tell me, I basically arrange my chemotherapy to fit their radiation. So
Okay.
once we know when they start, we'll arrange your chemotherapy accordingly. It
Is
does.
it the same day?
We like to start it with day 1. So the radiation is going to be Monday through Friday most
Right.
days. I believe that the week of Christmas, they might do it Wednesday through Saturday instead, just because Monday and Tuesday I think they're closed. I'm not sure about New Year's week. I'll ask them to let you know about that. We're gonna do your first day of chemotherapy with the first day of radiation. So if that's Wednesday, we'll do chemotherapy on Wednesday as well. And then we can talk later on. Sometimes we move it a bit towards the earlier in the week. Like if you do it on Wednesday, maybe the next week we'll do it on Tuesday and then on Monday, because I like to keep the chemotherapy on Monday. The idea is to have the chemotherapy in your body when you're getting radiation as much as possible.
Okay,
We want as much overlap as we can.
And that'll still be in Encinitas?
It depends on where you prefer for it to be.
Yeah, okay.
So you're going to be at the. I know it's closer to where you live, but closer to the proton center might be here, because you're going to be coming back and forth from the proton center.
Right,
So because
got it.
that's just a couple. That's kind of Sorrento Valley area.
Okay.
So you can let us know what you prefer. You don't have to decide that today. Today we're going to go over the consent forms. It's the same drug that you've already been getting, but because it's a different dose and a different schedule, we have to have you sign a new set of consent forms. So Linda will go over those with you and all that good stuff.
Great.
What other questions?
There were some, I'm starting to think about life after.
Yeah.
And like, how am I going to manage this? And there are some alternative treatments and some adjunct treatments. I wanted your opinion on some of those. I had sent Emily
Yeah, and I saw those and I replied to that.
Oh, okay, great.
Yeah,
I'll
but
look at that then.
basically, the one, the GCMAF, the scientists that were involved in that and involved in some of the early publications have pretty much been discredited for falsifying a lot of work.
Oh.
So I don't have a lot of faith in that one.
Yeah.
The other two, I looked at the links you sent, and it always makes me a little skeptical when someone says like clinical trials were started in 2008, but there are no results yet. Because for most clinical trials started in 2008, we have results by now.
Yeah.
So it does make me think that either the clinical trials didn't get completed or didn't get the results that they wanted. So for right now, things that you can do kind of less medically that have been more shown to improve quality of life. Acupuncture can really help some people through treatment. Not normally covered by insurance, but if that's something you want to explore, I would encourage you to do that. Some evidence that it can help with nausea and also with dry mouth after radiation.
Okay.
Also some evidence that it can help with pain, so I think that's a good option.
Cool.
Some people find ginger to be very helpful for nausea.
Sure.
There's no for my patients, it varies what formulations help most. There's candies that are ginger. Some people like the pickled ginger, like the kind you get from sushi restaurants.
Yeah.
Some people like flat ginger ale. If you do the ginger ale or the candies, I would encourage you to look for the low sugar ones, because we don't want to give you cavities during all of this too. But I think those are a couple alternative therapies that are more helpful. As far as the kind of mental fogginess, there's unfortunately not great evidence for what you can do to help with that. It does seem for most people to get better after the end of treatment. I think mental exercises are helpful, so things like crossword puzzles, and I don't think those apps that advertise like brain exercises really are onto anything magical, but if you find some sort of like puzzle that you like Sudoku or crossword puzzles or just some sort of game that kind of gets you thinking, I don't think there's a lot of harm in that, and I think it could be helpful.
Okay.
I have a question about earlier on when we were talking about the different radiation therapies. There was, we were told that, and I think it's the one we're not getting, but that it could feel like his throat's on fire and he'd mainly want fluids. But is that different because he's getting the proton?
So will still be some of that. Your throat is going to be part of the area that gets radiation because that's part of where your tumor is. So for most people, they will notice some discomfort with swallowing. It's basically like a sunburn on the inside. A lot of people, radiation and chemotherapy affect their appetite, but keeping on your weight is very important. I mean, calories are your body's building blocks. If you're not getting enough calories, you're going to get weaker. So for some people, eating really feels like it takes effort. Like right now, eating's probably enjoyable. You look forward to meals. But on radiation, a lot of people find that they have to kind of force themselves to eat. That all will get better when you're done. That sunburn is a very temporary thing. But unfortunately, it kind of comes with the radiation, and there's no way really to prevent it. It's just something you power through and then gets better on its own.
Okay.
I wouldn't expect the swallowing discomfort to be as bad as for someone who is, say, getting radiation to the throat lower down. Yours will be a little bit higher up, so it won't be quite as much in the swallowing tube. But if you ask Dr. Sangvi, once he makes the map, he should be able to show you all over what radiation doses he expects various parts of your body to get. Because that's what the map making part is figuring out how they can maximize the dose to the tumor, minimize the dose to everything else. So they have these cool kind of topographical maps that they can show you on their computer screens. I don't have access to those, but he and his team should be able to show you.
So most of what I'm going to be experiencing from the brain fog is probably going to be from the cisplatin again. I mean, the radiation is going to give me that.
I don't, as far as what causes brain fog, it's really not well known. Some people feel like radiation makes them feel foggy. Some people feel like chemotherapy. It's not clear if any chemotherapy drugs are higher risk than other chemotherapy drugs. So not clear to me that cisplatin is obviously the culprit, but we'll see what happens.
Yeah, okay.
Yeah.
Okay. All right.
What else? Anything else? Okay. Good. So I printed out these results
Thank you.
for you, and they'll both be, the reports will both be available on my chart. And then I know you and Emily were working with medical records to get the actual discs themselves.
Yeah.
And then just to clarify, so like halfway through radiation, will we, or at the end of radiation, then we'll talk about the liver and treatment for the liver.
Correct. Yeah. Okay.
Okay.
Okay. Do you mind if I press on your neck a little bit?
No.
Sorry,
No.
I'm going to try to warm up my hands
It's
for
okay.
you.
It's okay. Oh wow. Hey,
I know, I'm so sorry.
Oh my gosh.
I know. That's the bad part about coming in for my morning appointments.
Yeah.
They tend to warm up by the afternoon, but okay, open wide and say ah. Good. I don't see any mouth sores. Have you felt any at all?
No.
Good. And this looks good. Yeah, the swelling looks like it's pretty much gone.
Okay.
Okay, I'm gonna listen under your neckline a little bit to your heart if you don't mind. Good. Okay. And if you don't mind taking off your jacket so I can get a good listen to those songs. Thank you. Okay. Perfect. Deep breath. Perfect. You can sit back down if you're more comfortable. Let's see your fingernails. So you may notice as your fingernails grow out that there's kind of a weak part of it, like
Yeah, I felt some of that already on one. That was
Yeah.
surprising.
Yeah, so and as it grows, it'll take time to grow out.
Mm.
That's the taxotere. So since you're not getting any more taxotere, it shouldn't get worse. But since nails take a while to grow out, you probably want to just keep them short as you are. You know, they look nice and well groomed right now, so keep that up. But that's kind of to be expected.
Okay.
It's not a permanent thing, but like I said, you'll notice it for a few months just because it takes that time for new nail to get all the way up to the tip. Let's see. Oh,
Go
sorry.
ahead. No, go ahead.
Good. Ankles look good. No swelling down there. Perfect.
I was having some tingling. I don't right now. Having some shaking in my hands, and I haven't had any caffeine since yesterday morning.
Yeah.
Sometimes it's from the cold. Sometimes it might be from caffeine, but there's other shaking that I think is happening separate from that.
Okay, we'll check some electrolytes today if you're willing to stop by the lab and just make sure that there's not any, low potassium or magnesium or something.
Okay. I am getting blood test again, right? For I am
Yeah.
getting
Yeah. So we'll have you get the blood test today.
Okay.
Good. Anything else? Any hearing changes that you've noticed at all?
Not. The only thing has just been the cessation of the pain and ringing or kind of like I mean everything's improved with the hearing.
Good. Good. Okay.
My vision sometimes gets worse.
Really?
Yeah. Like I've been expecting a decline in my what would I call it, the script, right? The measurement of my eye. That's just been getting worse, and sometimes it's like for a couple hours, and then it'll get better. Like right now, I'm feeling okay with my vision. It's pretty clear, it's straight, but sometimes it gets really difficult.
Okay.
Yeah.
And I would definitely talk to Dr. Sangvi and see if he expects any visual changes during treatment, because where this tumor is located, it's not too far away from the nerves to your eye.
Yeah.
So he should be able to tell you how much radiation that area is going to get.
Okay. All right. Yeah. Well, I guess,
It's
we're just making progress along the way.
Yeah.
So.
I mean, I know it feels slow, but I'm really happy with what I'm seeing, and we'll carry on. So
Okay.
normally I like to see you back about every 2 weeks during radiation therapy.
Okay.
If things are going well, we can occasionally stretch that out to 3 weeks. If you need a little bit more TLC, we can do it every week, but we'll start off with every 2 weeks and go from there.
Okay.
Okay, great.
All right.
So Linda's gonna talk to you about the chemotherapy, and then I'll be back in with the consent form for you to sign in a few minutes.
Okay.
Okay.
Thanks.
So good to see you again.
Thank you, Dr.
Sorry about the
Gold.
cold hands. Good to see you both.
Yeah, you get
Oh,
gold
that
star
looks-
for your cold hands.
That looks like a good book.
It's a good book.
He's 3, you said, right?
4.
4.
Yeah.
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 Cool.
Yeah.
It was very exciting.
Yes, it is.
Yes. And dinosaurs too. Is he into dinosaurs? Not yet.
A little bit.
Just a little. He's
Okay.
more into the transportation.
I have 3 boys, and they
Oh,
were
do
all
you?
into transportation, like Thomas and
Oh yeah.
garbage trucks.
Oh,
Mm.
garbage
Mm.
trucks,
For
yeah.
it. Yeah.
Mm.
We got to know our the garbage man very
Yeah,
well.
awesome.
Nice.
Okay, so the chemotherapy is just a cisplatin.
Uh-huh.
So just one drug every week while you're getting the proton therapy. Once the proton therapy is done, you don't get any more drugs, okay? The day is still gonna be long. We're looking at maybe about 5 hours now. You can get this either here or at Encinitas, so we'll, just let us know.
Yeah.
What's gonna happen is we already got it approved through your insurance. We're just waiting for the start date of the
Okay.
proton. Then I'll request that from the infusion center to start the infusion on that day.
Okay.
And then we'll coordinate with the proton therapy on their time, so it'll give you guys some time to come over here and not like,
Right.
bam, bam, because usually we have our patients get radiation here and they just kind of, back to back, so
Got
we'll
it.
kind of space it out just a smidge. But it'll start on the same day and then eventually we'll transition to Mondays,
Got
okay? Things to look out for. The tingling, the numbness in your feet that you experience, it may come back and it may persist, but if
Okay.
it's bothersome, please let us know.
Okay.
This could be in your toes or in your fingertips. So
Okay.
if you start noticing your zipper, using anything with your fingertips, using keys to open door, holding things, if you start noticing, weird feelings, numbness, shooting pain, let us know.
Okay.
Okay, hearing, it may continue to affect your hearing. I
Okay.
know you're saying it's improved.
better,
Is
yeah.
it? Yeah. So if you start noticing increase in ringing in the ears or difficulty hearing, let us know about that.
Okay.
Some people they feel like there's a metallic taste in their mouth.
Mhm.
Now the radiation, depending on where Dr. Sammy is aiming the radiation, sometimes your taste buds go, so
Mhm.
food's not going to taste very well, very good. But I'm not sure exactly where he's planning on or if we're able to avoid any of the taste buds, but
Right.
just notice,
Sure.
if you start noticing food tasting weird,
Yeah.
it may be the effect of the radiation combo with the chemotherapy.
Okay.
Okay.
Alright.
Other things to know, the hair, it may continue to lose some, but after treatment it should all come back.
Okay.
Any hair